Hi, this is Brendan. This video is designed to explain your post-operative recovery from cataract surgery to make the process as safe, easy and stress-free as possible. It answers questions about the do's and don'ts post-surgery. Knowing what to expect makes the whole process easier, less stressful and hopefully even enjoyable. What to expect in the first few hours to days. Every eye is unique. Your recovery from one eye can be completely different from the recovery from surgery in your other eye. Post-surgery, you will have a shield on to protect your eye and to ensure that you do not rub it. Wear this for 3 nights during your sleep. If you are allergic to adhesive tapes, the staff in recovery will provide you with goggles secured by elastic. You do not need to wear your shield during the day. There's one really important difference between routine cataract surgery and cataract surgery with a hydrus stent for high pressure in the eye or glaucoma. And that is that some patients, not all, but some patients after cataract surgery alone will see very well the next day. When we insert the glaucoma stent, there is almost always bleeding inside the eye. Remember, that bleeding is not bad. The bleeding means the stent is in the right position and is forming a shunt between the fluid inside your eye and your bloodstream. So that means the stent is working well. But that blood also really affects your vision. It's perfectly normal for your vision to be very, very blurry the next day. That can last for anywhere from 3 to 7 days. When it starts clearing very, very quickly typically. It also fluctuates. Patients will often say their vision is terrible of a morning, but then gets better and better throughout the course of the day. And of course, that's because the blood settles down in the eye with gravity. So don't be alarmed at all. Because you've had the hydrus stent, it's perfectly normal for your vision to be very, very blurry. You should see it as a good thing, not a bad thing. Post-operative discomfort varies, sometimes enormously. The local anaesthetic wears off in about 25 to 30 minutes. So after this time, some people feel minimal discomfort, whilst others are very uncomfortable. This can last for a few hours. Variation in pain and vision is completely normal. You might have no pain and good vision the next day in one eye, but be quite uncomfortable with poor vision for a few days in the other. If your eye is sore, use lubricating drops and over-the-counter pain relief, such as paracetamol and or ibuprofen. Rest and sleep really help. Your surgery day is a big day. Most people go home and have a sleep for a few hours. Post-surgery, your eyes may appear perfectly white or very red. This is completely normal. Remember, as brutal as it sounds, I have stuck a sharp knife in your eye. It's amazing that they aren't all red. Some people may have a small bleed under the surface layer of the eye called a subconjunctival hemorrhage. These look serious, but are completely harmless and fade over a week or 2. The blood may turn orange, then yellow, before the eye returns to a nice white colour. This is more common in people who take blood thinning medications or omega-3 supplements. Your pupils will be dilated for the surgery, causing light sensitivity, blurriness, and halos around lights for about 24 hours. Some people have great vision the next morning. For others, it may take a few days for good vision, and occasionally good vision may even take a couple of weeks. Factors like eye size and cataract severity affect your recovery. Don't worry if your experience differs from others. Variability is really common. Again, it is perfectly normal for there to be a big difference between your eyes. Post-surgical nasal dryness and sneezing are common and often mistaken for allergies. In fact, this is usually caused by dry nasal passages from the oxygen delivered nasally during your surgery. Instead of antihistamines, which dry you out further, steam your nasal passages for relief. This can be done easily in a steamed-up bathroom from a hot shower. The hospital provides sunglasses to assist with post-operative glare and light sensitivity. These aren't medically necessary. They are convenient for outdoor protection and fitting over spectacles. They are definitely not stylish. Feel free to immediately and urgently replace them with any comfortable UV-blocking sunglasses that you feel suit you. Remember, only rock stars can wear sunglasses indoors or at night time. Many patients experience a flickering light in their peripheral vision after cataract surgery, especially out to the side. This is a common occurrence and usually resolves within a few weeks. It is often noticed the day after surgery, but typically settles down on its own without cause for concern or need for intervention. After cataract surgery, all patients need anti-inflammatory drops. These drops help to avoid swelling in the back of your eye. You will be given a tick box sheet to assist with compliance. Antibiotic drops are unnecessary, as the equivalent of nearly an entire bottle of antibiotic drops are injected into the eye during the surgery. Many people use an app on their smartphone to remind them to use the drops. Here you can see me awkwardly demonstrating a good technique that involves lying flat and resting the notch on the drop bottle on the bridge of my nose. If you then squeeze the bottle and blink a few times, some drops will go into your eye. Don't worry if more than one drop goes in. Your eye only holds one drop, so the excess will just wash out. Sometimes the dexamethasone drops will sting for the first few days after surgery. This tends to settle very quickly. Many patients having the hydrus stent inserted will have been on glaucoma drops prior to their operation. I will always tell you if you need to continue these after your surgery. Almost everybody will be able to stop them, but some people will need them for a few days or a week or two immediately after the operation. It's really important to also realise that most glaucoma drops will profoundly exacerbate dry eyes. They cause dry eyes, and that means if you start with dry eyes at the start of your cataract operation or before your cataract operation, there will always be dry afterwards. The biggest culprits for this are the medications like Xalatan, Lumigan and Travatan, or all of the different generic names associated with them. But the moral of the story here is if you're on glaucoma medications or drops prior to your cataract surgery, you should expect drier eyes afterwards. But if we get you off those medications, in the longer term, those dry eye symptoms should hopefully enormously reduce or hopefully even disappear. Dry eyes are an extremely common post-surgery issue. The confusing fact here is that it almost never presents as an eye that feels dry and scratchy. A better term is tear film instability. This more accurately describes the fact that your tears are made from oil and water. These layers need to exist in balance to create comfortable and lubricated eyes with stable vision. For a few months after surgery, the oily layer of your tears tends to break up too quickly. The oil layer is what does most of the lubrication and vision stabilization work of the tears. This means that your dry eye symptoms tend to be fluctuating vision, watery eyes, eye fatigue, heavy or droopy eyelids, or even excessive tearing. It is much more prevalent in people with rosacea, postmenopausal women, Botox users, CPAP machine users, and in people on certain medications. Dry eyes can cause a vicious cycle of saltier tears which damage the surface of the eye, worsening the dryness. Breaking this cycle is crucial. Use the provided lubricants in your post-operative pack to dilute tear saltiness and restore normal tears. Various types of lubricants are available, often preservative-free, in watery form, oil, or in combination forms. The appropriate type will be selected for you for your surgery, but feel free to use any over-the-counter option that you like. Remember, no eye rubbing is allowed. Generally, you can wait until after your medicated post-operative drops finish before you start the lubricants. However, if you are experiencing any dry eye symptoms, feel free to start the lubricants earlier. What you can and can't do post-surgery. Post-cataract surgery, it is crucial not to rub your eyes for about a week. Use the protective shield while sleeping for the first 3 nights. Here is what you can and can't do after the operation. Showering and hair washing. It is perfectly okay to shower and wash your hair as usual. The only thing you can't do is to look directly into the stream of water with your eyes open. If you do this regularly, you have some seriously strange showering habits anyway. You can wash your hair as normal, just don't get lots of shampoo in your eyes and rub them. Anything you did in the shower before your surgery, you can do in the shower after your surgery. Heavy lifting. Lifting grandchildren, grocery bags, and even reasonable weights at the gym is allowed. Just be cautious and avoid overly excessive strain. Exercise. Yoga, golf, the world's most common form of torture, and other non-contact sports are fine 48 hours after surgery. Contact sports should be avoided for 2 weeks after the operation. Gardening. Like gardening is perfectly okay. Avoid activities that might expose your eyes to dirt and debris though. Cycling. For all you two-wheeled bandits, Cycling is permitted, but be cautious, especially environments that might expose your eyes to dust or debris. Swimming. Wait at least 3 weeks before swimming in a clean pool with goggles and 4 weeks for other swimming activities. Eye makeup. Wait a full week before using eye makeup, as it can contain bacteria and removing it typically involves rubbing your eyes. Emergencies. Emergencies after cataract surgery are thankfully very rare, but if one occurs, contact me directly. During business hours, reach me directly on the clinic's landline. After hours or on weekends, use my mobile number from your post-operative pack. You have the number on the written handout that you receive in recovery. I am often in surgery during the day and I don't often have mobile reception in theatre, so make sure you contact the clinic during business hours. As I've said, emergencies are rare, but if you are worried, it's always better to ask for advice. The primary concerns are infection and retinal problems. Infections are extremely rare thanks to the antibiotics used during surgery. Symptoms would include severe pain, sensitivity to light, poor vision, and intense redness. Contact me immediately if these occur. For retinal issues, like significantly altered vision or a curtain effect, again, get in touch straight away. As I said previously, you don't have to worry if you have a painless red eye with good vision. This is called a subconjunctival hemorrhage. These occur when a small blood vessel bleeds between the thick white layer of your eye and the clear overlying layer. These look scary, but resolve by themselves and never cause any harm. If you are unsure about any issues post-operation, please feel free to contact me. For after-hours or weekend concerns, text me with your name, surgery date, and details of the operation. Include a photo if needed. Remember, I won't have your contact number saved in my phone, so include essential details for context, please. Lost prescriptions or medication repeats can be sorted out the next business day. Lubricating drops don't require a prescription and can simply be purchased over the counter at a pharmacy. Remember, feel free to try different brands of lubricants if you would like to. Your optometrist will also have recommendations for good versions. Glasses. Your requirement for glasses post-surgery will be dependent on what lenses we have chosen for your eye. Between your procedures, some people will remove the lens from one side of their spectacles. However, this may not be suitable for people with strong glasses due to the fact that the eye and brain can only tolerate a certain level of difference between the eyes. Contact lens wearers might use a lens in the non-operated eye for comfort. Post-surgery, you may rely more on the operated eye and less on the one still with a cataract. Remember, you can always ask me or one of my team what you should do. For reading glasses, you can initially use a cheap pair from a pharmacy. These are pretty lousy optically. You will definitely notice the difference between these and the pair you get from your optometrist about 5 to 6 weeks after your operation. Always make sure you use your lubricants religiously in the week before you go to see your optometrist for your new glasses, as this will stabilize your tears and your glasses prescription. We constantly strive to improve our processes and ensure your comfort during surgery and afterwards. If you really thought the process was great, a 5-star review on Google or social media is a wonderful thank you. Feedback. I really try to ensure that your cataract surgery is as stress-free and routine as any surgery can be. Feedback on your surgical experience is very, very welcome. Feel free to share any comments, positive or negative, directly with me or anonymously through the hospital feedback form that they will give you in recovery. I really do feel that it's an extraordinary privilege for someone to trust me to operate on their eye. If there's any part of the process that you feel hasn't been good or that you think can be improved, I really do value your opinion enormously.